own visa, and shall I simply say, distinguished guests and my colleagues from Zambia. Listening to Michael and listening to presentations earlier, I was reminded of two things. Two things. One is, can you speak from the heart, or you speak from the head? Right. And I thought today, I'm going to speak to both the head and the heart. And I want to begin by saying to my colleague who gave an excellent presentation on public health, and say it to you that we had prepared a PowerPoint presentation, but the last minute, because of certain logistical issues, seeing that our bags are somewhere else, I decided that we're not going to do a PowerPoint presentation. And that reminded me that something about PowerPoint, that if power corrupts, PowerPoint corrupts absolutely. So I'm not going to give a PowerPoint presentation today. Thank you. Once upon a time, ladies and gentlemen, once upon a time, as Michael said, Michael and I met, and I said to Michael, Michael, there must be a way you can help the Copper Belt University. It's a young university, and it needs so much assistance. Then he said to me, what areas do you want to help in? I said, medicine. We need to build a school of medicine. We have started a school of medicine, but it's operating in not on a normal campus. It's operating out of a hospital, but we need it. We need that campus, the school of medicine. Then he said to me, look, I can't promise anything. And indeed, I didn't hear from Michael for quite a while. I can't remember how many months had passed. Then one day I received a telephone call, which changed everything. And in the call he said, Nathan, this is Michael. I said, yes, I recognize the voice. He said, I guess you are surprised that I've called. I said, absolutely surprised. Then he asked me, I think, whether I was sitting or standing. He must have suggested that perhaps I should sit down or something of that sort. Then he said to me, look, he had thought about this, and he had consulted some colleagues, and yes, he was in a position to say that they could help the Copper Belt University with some money. At that time, $700,000 was mentioned. So I did not know what to do. I sat down and I paced up and down. Eventually I told my colleagues that, look, this is the news. The news which absolutely changed everything. From there on, it has never been the same. To cut a long story short, by the time I went to see Michael, because he had suggested that I come over to Lusaka, those of you who don't know where Copper Belt is, Copper Belt is about slightly over 300 kilometers from Lusaka. And of course, that's where the money for Zambia is made. Lusaka, where Michael stays, those are the ones who use the money. We don't use the money. So anyway, so then, by the time I went to see Michael, Michael said to me, look, it's no longer $700,000, it's $1 million. So I said, my God, this indeed must be heaven today. And so the rest became history. We had, at that time, the Copper Belt University has 8 schools, 1 institute, and 1 directorate. And one of our schools is the Belt environment. In other words, that school, they do architectural drawings. And so I immediately tasked the head of the school to put together a plan for the School of Medicine. And boy, was it a plan. He asked me actually, the head, and said to me, how elaborate? I said, as elaborate as is possible. It must not beat, it must beat every other school of medicine in our region. And at that time, the latest school of medicine, which we had seen around, certainly not in South Africa, they are much older, was in Namibia. Excellent school of medicine, at least in terms of the structure. So I went to look at it, and so did Professor Bo. And he was very impressed with it. And then we sent the architect there twice, not once, but twice, to make sure that he really understood it well. And that he should now build something a lot better than that one. And that's exactly what he did. And it's such a pity, ladies and gentlemen, that I don't have the PowerPoint to show you that School of Medicine. In fact, once it's done, in fact, the first part of it is going to be ready by end of July, and the rest of the school will be ready by end of October. So Professor Bowen is going to have his school, and that school, from what I've been able to see and be able to investigate, is going to be not only the biggest, but the best looking school south of the Sahara, if not in the entire continent. I do know one thing, that it is going to be better than the School of Medicine in South Africa. It's, Cape Town, yes, madam, much better than the School of Medicine in Cape Town. Whether you talk about Stellenbosch, you talk about University of Cape Town itself, yes, it will be better than even what Witwatersrand has. It is going to be better than what Botswana has. And what more, that is the school which will also have a hospital for the School of Medicine. So, to us at the Copperbelt University, it's more than a dream, it's more than a vision realized. It's a reality. It's the working of human beings. What human beings, in their very basic sense, can do. Because I should have mentioned earlier, ladies and gentlemen, that before I met Michael, I met Eb Galon, who was Michael's father. At that time, I used to be in the Defense Force. And I knew Eb for quite a number of years, right, as a very strong-minded and very warm individual at the same time. So we are therefore very grateful about the school, whose details I'm going to request Professor Bowa to talk to. But we are so pleased with this school that we believe that we ought the relationship between the public health institution here at this university, TelAviv, must just be the beginning. The kind of collaboration which we seek to have, Mr. President, with this great university is actually with the entire School of Medicine, the entire Faculty of Health Sciences in this university. And of course, we seek to go even beyond the relationship at the medical level, to touch other areas which are so important, which we know this university has been renowned for, so that us too can build up the Copperbelt University to what it really ought to be. Mention has been made of our efforts at the moment to develop the area of resources, natural resources, where my colleague Dr. Kasumu has a number of her students here, second cohort, going through an 11 months, is it? 11 months program here in Israel, and one which will continue for some time. So, as I end this indication of my gratitude to not only Michael Galoon and to the Jewish community in Zambia and other friends of the Jewish community in Zambia, please let me say this, that never have I felt so moved by a people who themselves are an indication of what strength can do, what the strength of humanity can do, in order, how that strength of humanity can build a people for them to be able to do impossible things look easy. We only have to look at what Israel has achieved in the several years past, despite the odds which this great nation has passed through. It's incredible that whatever the Israelis seem to touch appears to turn into, I was going to say gold, but into green and into everything else, which is fantastic. Absolutely. Now we hope that we'll learn a lot from that experience. We'll learn a lot from that relationship with TelAviv University. And certainly that will definitely learn a lot from the medical point of view. And with that then, I wish to request the Professor to complete the presentation by matching the technical details of the Director of Public Health with his own presentation. Thank you.